Hey guys, my name is Todd Dietary. This is TD's Fat to Fit, your free online strength and conditioning coach in your pocket. Today we're going to jump right into it, talking about blood pressure. This is something that is very important to all of us, strength athletes, bodybuilders, fitness athletes, you name it. If you're trying to grow and get stronger, you have to deal with blood pressure, something that you need to deal with. 50% of all adults in America have high blood pressure. So let's do a deep dive on blood pressure. What is it? Why is it an issue? How is it something that we can deal with, or why is it so important, and what to do about it? You get two numbers with blood pressure. The high number, which is the initial pump pressure of the heart squeezing, and then the relaxation of the heart when it opens and fills with blood, that's the lower number, the diastolic. So there's the high pressure and the low pressure. Pump pressure, relaxation pressure. Output, input. That's systolic, diastolic, okay? Not that it really matters, but it gives you an idea as to what the two numbers mean. It's basically output, relaxing, or filling. Input, output. You typically want your blood pressure to be like 120 over 70. That's awesome. Or 110 over 65. Even better. Unfortunately, some of us that are 250 pounds or bigger and bodybuilders or strength athletes are eating like crazy and trying to get stronger and bigger, you might see a few more numbers that are a little higher than that, unfortunately, like 180 over 120 or 200 over 150. I've never seen that before. I'm laughing because it's not funny, but anyways, this is what this presentation's for, right? And they recently changed the parameters of high blood pressure. Now, anything above 130 over 80 is determined initially high, unfortunately. It used to be 140 over 90. Anything under 140 over 90 was fine, but they've reduced it over and over and over the years. So that's where it's at. Anything over 130 over 80, you probably have high blood pressure and you need to do something about it. So there's no lower limit. The lower limit is just the lower pressure, and you'll get side effects. Like, so let's say you stand up really fast and you get dizzy, you get wobbly. That's low blood pressure. You can't really have too low pressure for the heart because the heart is a muscle that works over your lifetime. It does wear out, so to speak. The valves start to wear down. So having less pressure over a lifetime is a really good thing. Having high pressure over a lifetime is a really bad thing. A high blood pressure increases the risk of kidney failure, heart disease, heart failure, stroke, arteriosclerosis, Alzheimer's, and dementia, just to name a couple. Having high blood pressure for long periods for many years will damage the valves, causing heart failure, cardiac arrest. High blood pressure will slowly wear out the delicate valves, needing replacement or repair. This is the left ventricle valve or mitral valve. High blood pressure also damages the capillaries, starving the brain of blood, and that would be causing a stroke or Alzheimer's or dementia. And additional damage can be done in the small vessels and tubules going into the kidneys. And that's why you hear in bodybuilding kidney disease constantly. All the older guys that had crazy cycles back in the 70s and 80s are now dealing with kidney issues because they killed their kidneys during that period of long, high blood pressure from all the anabolics and androgens they were taking. This is critical to examine. If you are a bodybuilder or strength athlete, we are constantly inflamed, eating high protein diets in excess to grow and get stronger. Regardless of your fat or muscle, if you're 250 pounds, the heart has to pump the blood through that 250 pound body. And that's difficult for one small organ the size of your fist to pump all that blood through our entire body, regardless if it's 250 pounds of fat or muscle. That's a hard job. And that's where you get enlargement of the heart, or what's called left ventricular hypertrophy. So think about it. We're in the gym, we work out for an hour, we go home and we rest. Our heart doesn't have that rest period. Our heart is pumping all that blood while we're doing that intense workout at the gym. And then we come home and it's still going to pump all that blood through this huge body. It wears out. And not only does it wear out, it gets thicker because the muscle builds. It's a muscle. The heart is a muscle, and it gets thicker, and that's when you get enlargement of the heart. That reduces its output capability. And this is why You start to see heart issues over time and complications with the heart with bodybuilders and large athletes. And my video is to try to mitigate some of those issues through natural means, supplements, and through pharmaceuticals. Either way, any one of those is a better option than dealing with high blood pressure over a lifetime. Something else with blood pressure is this flexibility of the arteries and the vessels. That flexibility is derived from this elastin compound inside the vessels and the arteries. That starts to degrade with age. And the more that degrades with age, and because of inflammatory diets, diabetes, metabolic disease, and other factors, lifestyle factors like sedentary lifestyle, as that drops, blood pressure rises. And something that we've been demonizing it for so long is sodium. We always think, oh, it's sodium that drives up blood pressure. No, it's not. It's just like sugar as to fat. Fat has been demonized as the issue, not sugar. Same exact thing. What causes inflammation? Sugar and carbohydrates, highly processed foods, industrial seed oils. Same thing as sodium. Sodium is an essential nutrient needed for heart health. Yet, for some reason, it's been demonized and is the cause of high blood pressure. Total bullshit. Not the case at all. We need a normal, actually a functional level of sodium to make the heart pump. It is called the sodium potassium pump. This is the heart. If you don't have the right amount of sodium or the right amount of potassium, your heart is not going to operate properly. You will go into heart failure if you don't have enough sodium. Same thing as potassium. If you don't have enough potassium, you will have heart failure. But sodium is essential for proper heart health. It is not the enemy. So what happens with long-term hypertension? Elasticity drops, the flexibility of the tube drops, and pressure rises. The pressure rises as you could think of about like a plastic pipe. If you go in and put a ton of pressure into a plastic tube, it'll crack. And that's what happens in our bodies. So our bodies are smart, very smart. So what does it do? It sends cholesterol to repair the crack. There's the demonization of cholesterol, because now you have a blockage. Over time, that blockage gets worse, inflammation gets worse, and the whole process gets more, and it builds up even more, as you can see in this picture, and then you get a clot. Again, they go in and they extract all this plaque, cholesterol, out of the vessel wall, and then they say, there you go, cholesterol is the issue for heart disease. No, it's blood pressure and inflammation that initially caused the crack, and cholesterol came in to repair the crack. Cholesterol, fat, is not the issue. High blood pressure, inflammation, and a highly inflammatory diet or sedentary lifestyle is the issue. And that's the difference between medicine and functional medicine. What can we do to treat the disease, medicine, and functional medicine? Where did the disease come from? I don't care if the disease has a name. I don't care what the disease is. How did you get it? Let's fix the cause. If you have a house fire, you don't just sit there with an extinguisher and just put the fire at bay. You say, well, if there's an electricity issue, let's go fix the electrical issue and stop the fire in the first place. That's functional medicine. That's true medicine. Stop the disease from the progression, not the treatment of the disease. And this is where we can treat high blood pressure. Treat high blood pressure from the source, inflammation, not let's just take anti-cholesterol drugs and then take blood pressure medications and just act normally. There are some issues that you'd want to take for blood pressure medicines. We'll get into in a second, but you get where I'm saying. You get what I'm talking about, as to get to the root of the cause and then deal with it. Something else that happens over age is we lose our metabolic processes. As I've said in other videos, we lose our ability to digest and retain protein. That directly responds to how much nitric oxide and certain vitamins and minerals we are able to absorb and have. And that directly responds to high blood pressure, because nitric oxide is a vasodilator found at high levels in young adults. You'll never see high blood pressure in a healthy young adult. You just won't see it. But you will see high levels of nitric oxide. And vice versa, if you'll see an unhealthy older adult, you'll see very, very little levels of nitric oxide. So what do? Supplement. Other reasons for hypertension is potassium deficiency, again, low nitric oxide levels, zinc deficiency, vitamin D deficiency, corticosteroid use or prednisone, adrenal fatigue or aldosterone, cortisol, adrenaline, stress hormones. That's why stress is so important when it comes to blood pressure, thyroid issues, both hyper and hypothyroidism, androgens and estrogen also have a contributory factor to high blood pressure. Lifestyle issues, smoking, drinking, bad habits, major contributor to blood pressure. Metabolic disease, diabetes, sleep apnea or sleep disturbances like snoring, oxidative stress, free radicals, processed foods, industrial seed oils. All of those things can contribute to lower metabolic health, lower mitochondrial health, and higher blood pressure. Step one, what do? Go see your doctor now, especially if it's really high. Don't wait. This is something you have to deal with right now. So talk to your doctor. You're probably going to get a prescription for a blood pressure medicine, and it might be an ACE inhibitor or a diuretic or both. We're going to get into the different types of blood pressure medicines. You'll probably get blood work, check for low deficiency in vitamins and minerals, inflammatory markers, but also eliminate processed foods immediately. Eat whole foods, single ingredient foods. No processed industrial seed oils or hydrogenated seed oils. All of those contribute to high blood pressure. Go outside, exercise, get sun exposure, specifically in the morning. Get sun exposure in the morning. You don't have to work out in the morning, but get sun exposure in the morning. This is vital to the amount of vitamin D that you can get if you're not supplementing with vitamin D. Go for a walk, join a gym, go for a bike ride, swim, whatever you love to do active-wise, go do it. All of this stuff will help with blood pressure. So when you get a prescription, most likely you'll start with an ACE inhibitor. This is an angiotensin 2 enzyme inhibitor. Basically, angiotensin is a vasoconstrictor, and the enzyme angiotensin 2, the ACE inhibitor stops that enzyme, which relaxes the vessel wall. Lisinopril, you can get 5, 10, 20, 40. Ramipril is another one. But things you want to talk to your doctor about is your lifestyle, and that will change depending on the diuretic, or the prescription will change based on your lifestyle, and I'll get into that in a second. Depending on the side effects, ACE inhibitors tell vessel walls and arteries to relax and open. Diuretics do the same. Beta blockers lower your heart rate and block the hormone epinephrine. This is serious for gym athletes. Will not do well on this drug. This causes lower heartbeat and less force. Not something you want if you want to work out and do endurance athlete. Or if you're an endurance athlete, or if you're a strength athlete, or you're in the gym a lot, that's not something you're going to like, because you won't be able to get your blood circulating. You won't be able to increase your blood pressure and your heart rate to get a good workout. You need to be able to do those things. ACE inhibitors and ARBs don't typically do that. They just deal with the vessels, not the heart specifically. And calcium channel blockers or beta blockers directly impact the heart. Long-term strategy. Go back to your doctor and check your levels in about a month or 2 months. Start weight training, have a plan to lose body fat, increase muscle mass, and reverse metabolic disease. Supplements. Start supplementing with omega-3s. This is vital for blood pressure, vital for heart health, vital for so many other reasons. But omega-3s is like the ultimate of all ultimate supplements. There's not a person on earth that shouldn't supplement with omega-3 fatty acids every single day, 1 to 3 grams daily. Vitamin D3. Definitely, if you're living in the northern latitudes or you don't go outside much, you're going to want, or if you're fair-skinned, you're going to want vitamin D3. Again, check your blood work. If your vitamin D level is under 50, you probably should be supplementing with vitamin D. It should be around 100. You can supplement with taurine, amino acid arginine, amino acid citrulline, magnesium threonate or chelate, zinc. Also, something you can supplement. These are all supplements taken daily that can really impact your blood pressure over time. The goal is to get off the medication once lifestyle and metabolism is corrected. Probably not possible for a 250-pound bodybuilder, but get additional blood work. And maybe with all of these other supplements, you can at least reduce the initial amount or potentially get off of it. So if you lose weight, you get metabolically healthy, you'll need less medication. If you lose 20, 30 pounds, there's no question you're going to need less medication. And then if you start supplementing with those other compounds, you may need to get rid of it completely. However, taking an ACE inhibitor or diuretic or both, and the slight issues with that, like dry cough or a nasal drip over a period, is a little better than kidney failure or heart failure or dementia. Sign me up for that any day of the week, because ACE inhibitors have a really high safety factor. They're very safe, long-term safe. So if I have to deal with a dry cough and not heart failure, I'll do that. Something else I want to talk about is the new world of longevity and anti-aging. There's a few new compounds, taurine and M&M specifically. Nitric oxide is also one of them, but they have incredible benefits. The side effects of these are really remarkable, very promising in the longevity space. Taurine specifically, just let's talk about taurine by itself. I'm going to do a video on both NMN and taurine alone, but just to name a couple of the side effects of taurine, it's approved in Japan for medical treatment of heart failure. So that's also how key it is. Taurine can drop your blood pressure by 10 points, both systolic and diastolic. It's protective of your heart and heart nerves. It's protective of your eye and eye health for glaucoma. It's protective in the optic nerve. It inhibits tumor cell growth. Its mechanism is through GABA receptors, so it relaxes the vessel walls, overall well-being, and relaxes and soothes the nervous system. Improves lipid metabolism. It's an antioxidant, supports mitochondrial health. It's a neurotransmitter. It's known to help grow neurons. Energy, improves endurance. It fights neurotoxins, improved immune system, improved digestion. It increases insulin sensitivity. It also helps with glycogen absorption. It increases lifespan in many animal trials. What I want you to take away from this video is the fact that there's a multi-step approach on how to deal with blood pressure, supplements, diet, lifestyle, anti-aging compounds, and pharmaceuticals, all of which are important to deal with blood pressure or hypertension. Get your blood pressure under control. Use every tactic known to man. Get it low, get it down, and then at that point, you can figure out, well, is this overkill or not? Most of these compounds have beneficial side effects, so you'd probably want to take them anyways. Who doesn't want to take nitric oxide? Arginine and citrulline, it's a great bodybuilding supplement. Taurine has all these incredible side effects. Vitamin D3 helps with metabolism. Omega-3s helps incredibly with heart health and overall inflammation in the body. Magnesium calms the nerves and settles the brain, helps you sleep. All of these supplements have really good beneficial side effects. Please like, subscribe, comment below, and share this with somebody that you think might benefit from the video. My name is Todd Dietary. This is TD's Fat to Fit. I'll talk to you soon.